It's really important when you're developing your social marketing project that you set clear behavioural goals. You need to have these clear behavioural goals in order to evaluate your project. That way you can evaluate not just if your project has had an impact on actual behaviour, but also if it's value for money. Don't just say it matters, had really clear behavioural goals. They were able to set these clear behavioural goals because they had good baseline data. They constantly evaluate their programme, not just to look at the impact on behaviour change, but also to see whether it is cost effective.
In New Zealand, estimated 200 women get cervical cancer every year, and of that 70 die. The real challenge here is it's a preventable disease. The research told us that Māori and Pacific women were harder to reach and they were having some challenges with getting them into the program. The 4 behavioural goals that the program set were to increase awareness and understanding of cervical cancer and the benefits of cervical screening, to increase discussion about cervical screening and a way to get families and friends and supporters involved in the program. The third one was looking at increasing the calls to the program, the 0800 number, and the fourth one was about looking at increasing the number of Māori and Pacific people getting involved in the program. The qualitative research is where we got the richness in the data, which was the focus group testing. I think there were some really basic things that we were really surprised about, which just the general lack of awareness around cervical cancer. One of the key things was embarrassment. There's a cultural aspect to this issue around Māori and Pacific not having discussions or conversations about this issue.
Can't believe you got us into this.
Got your flash undies on?
And the first insight we got around, particularly for Pacific, was about the collective responsibility, that this actually just wasn't about them themselves, that one of the motivations for them was about doing it for others. And that was similar for Māori. They really wanted to be around for their kids and their grandkids.
Go for me.
Those were really, really useful insights for us that we're able to feed into the campaign.
You go for your life.
Cost, there's no question, is a barrier to participate in any medical intervention, in actually getting to see your GP or your nurse. The more expensive it is, the less chance you're likely to go, and particularly if it's for a test that you can't see may benefit you in the future. The initiatives that were put in place in the different regions were very interesting. Some offered more free smears, some offered voucher systems. Some actually did hold home visits to enable those women who actually couldn't participate at a usual health centre to actually have a smear.
Once the program gained some momentum and some profile and awareness in the wider public, we got a lot of corporates who were interested to partner with us. The likes of Johnson & Johnson, who came on board, who were able to offer a range of freebies as part of our awareness month. The key thing here, when we're asking somebody to really consider making a behavioural change, the role of rewards and the role of incentives are really, really important. In terms of evaluating the program, we did the benchmark early on, and then every year we checked whether or not the messages were getting through. Then also the comparison in terms of calls to the program, over the last few years.
The campaign from the program's perspective has been extremely successful. It has really resulted in targeting and increasing participation in those priority groups' involvement in the program.
With Pacific coverage, we've had 60%, which is a huge step up from where they were originally at 29%. With Māori women, we've had an increase of around 54–55%. Again, that's a huge step up to where they were previously. And I think overall, the program's tracking for all women close to 74–75%.
Setting those goals of increasing coverage for Māori and Pacific women really got us to focus on what the ads we're trying to do, and therefore, developed successful advertising. If you're looking at it in terms of a value for money perspective, the more you invest up front and save downstream costs, the better. If we can invest $2 million per annum as we do in advertising, that breaks down to roughly $2 per eligible woman that we're focusing on. We're probably saving the health economy 2 or 3 times that per annum in terms of treatment cost. And then obviously there's the cost that you can't quantify, i.e. the cost of a life saved.